Can birth control or other medications affect the amount of bleeding during menstruation?
In this video, we will discuss whether birth control and other medications can affect the amount of bleeding during menstruation. We will cover different types of birth control methods, other medications, and their impact on menstrual bleeding.
How do birth control methods affect menstrual bleeding?
Birth control methods can have different effects on menstrual bleeding depending on the type of method used. Some may cause lighter periods, while others may lead to heavier or irregular bleeding. Hormonal contraceptives. Oral contraceptives, patches, and vaginal rings often make periods lighter and more regular. This is because they contain hormones that can stabilize the menstrual cycle and decrease the lining of the uterus. Intrauterine devices, IUDs. Hormonal IUDs generally cause lighter periods, while copper IUDs can sometimes cause heavier or longer periods, especially in the first few months of use. Progestin-only contraceptives. Birth control methods containing only progestin, such as the birth control shot or the progestin-only pill, may lead to irregular bleeding patterns or even a complete absence of menstruation.
What other medications can affect menstrual bleeding?
Several medications, aside from birth control, can also influence the amount of bleeding during menstruation. Anticoagulants. Blood-thinning medications like warfarin can cause heavier periods due to their effect on blood clotting. Nonsteroidal anti-inflammatory drugs, NSAIDs. These medications, often used to relieve menstrual pain, can reduce menstrual bleeding when taken during the period. Antidepressants. Some antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, may lead to changes in menstrual bleeding patterns. Thyroid medications. Both underactive and overactive thyroid conditions can affect menstrual bleeding, and taking thyroid medications to correct these imbalances may alter bleeding patterns.
Should I be concerned about changes in menstrual bleeding?
Although changes in menstrual bleeding can be a normal side effect of medications, it is essential to consult with a healthcare professional if you experience significantly heavier bleeding than usual, prolonged bleeding that lasts longer than 7 days, sudden changes in bleeding patterns, severe pain, or other concerning symptoms. These changes could indicate an underlying health issue or a complication related to the medication. In summary, birth control methods and other medications can indeed affect the amount of bleeding during menstruation. It is crucial to discuss any concerns or changes in bleeding patterns with a healthcare professional to ensure proper management and care.